So a growing number of you guys out there are doing dry January, taking a little break from alcohol for the entire month. But the health benefits can last even longer, especially for women. Thanks so much for staying with us. I'm Tamsin Fidel.
And I'm Ernie LeBeau. So the National Institutes of Health says even though women drink less than men, they are more sensitive to the effects of alcohol. So could a month of sobriety get your health back on track?
Yeah, well, joining us now to talk more about dry January, Dr. Jonathan Avery of New York Presbyterian and Weill Cornell Medicine. Thanks so much for being with us.
Thanks for having me. Always happy to talk about dry January.
Well, it is here. We're 10 days in. So what are the health benefits of dry January if you can stick to it or stick close to it?
You know, we hear a lot about the opiate epidemic, the youth vaping epidemic, but it really is alcohol that's going to get most of us in trouble over the course of our life. And, you know, this may not get me invited to many parties, but it turns out alcohol is a poison, and it, you know, negatively impacts almost every organ system in the body. So it impacts how you feel, your sleep, your mood, and anxiety. And so if you can take a little break from alcohol, certainly, you know, this month, but over the course of the year, you know, you really do start to feel better. You know, your brain and body is able to recover, you sleep better, your mood and anxiety improves.
I don't know about you, but I know a lot of people, as they get older, they start to feel those effects even more so now. So is actually 1 month long enough to get those benefits that you listed?
It is. That's the good news. Any breaks are good. You know, the body does recover pretty quickly. It's very malleable. But even more important than that, I think the importance of dry January really is to examine the role alcohol is playing in your life, what you're using it for. And sometimes that's clarified when you stop for a bit. And so the goal would be, like for any New Year's resolution, to, you know, keep these changes and have them last throughout the year, where even if you do return to drinking, you're drinking less, drinking more thoughtfully, and hopefully you've developed other ways to, you know, de-stress and have fun during this month.
I know, because some people are like, come on, February 1st. Let's, you know, they're ready to just make up for those last 4 weeks.
Exactly.
Yeah, so dry January can also reveal some potential withdrawal symptoms as well. What should people be watching out for and all that?
Yeah, so, you know, if you have been drinking every day, drinking multiple drinks, if you're a heavy drinker, it is important before stopping drinking suddenly to consult your provider, your healthcare provider, your internist or an addiction provider. Because while most withdrawal symptoms can be mild, anxiety, tremor, insomnia, there are a couple very severe symptoms that can develop when you stop drinking abruptly if you've been drinking a lot. And those can include seizure and death. And so if you contact your local doctor, they have meds that can help you withdraw safely, as well as treatments to help you stop if you're struggling to stop in general.
Okay, so doctor, how many drinks would you say a day is considered moderate for women and then for men?
So on average, you know, the data shows that 1 drink for women, 2 drinks on average for men a day is sort of moderate drinking. There's another category called binge drinking, where if you drink more than 2 to 4 drinks on a given occasion for women, or more than 3 to 5 for men, that's especially associated with negative health outcomes. And we pick these numbers not because we're finger waggers again or don't like to have fun. It's that because above these numbers, it doubles and triples your odds of developing the medical consequences of drinking, increases the odds of developing an alcohol use disorder. And so if you're trying to cut down, you know, those are good numbers to keep in mind so that you can know that you're drinking in a safer way.
So the National Institute on Alcohol Abuse and Alcoholism called drinking a growing health issue, especially for women. Why are they more at risk, and what problems could they face as a result of that?
You know, historically, men have, you know, used more alcohol, but over the last 10 years, we've seen more and more women drinking. And then certainly COVID-19 provided a lot of stressors that uniquely impacted women, where there was just sort of nothing else to turn to. We were stressed, you know, having to manage kids and finances and everything else. And so we've seen record numbers of women drinking and presenting to care. And as you mentioned at the outset, that women are more susceptible than men if they're drinking the same amount for the medical consequences, for different cancers. It impacts a lot of organ systems, as I mentioned earlier. And so, you know, all of us need to pay attention, but especially to women that may be struggling.
Okay, so what is some advice you would have for people who, let's say they want to take a break from alcohol, whether it's for a month or even a few weeks?
I say do it now, get started. You know, I haven't seen that person at the end of their life that says, you know what, Dr. Avery, I really wish I drank more and partied more. You know? the regrets tend to be in the opposite direction. And so, if you can make these changes, it can go a long way for living a happier and healthier life. And so I would say just go for it. And if you do slip February 1st or, you find it hard, seek treatment, get help, or just keep trying because it is worth it to improve your relationship to alcohol.
Yeah, that's so true. Dr. Avery, thanks so much for joining us this afternoon. And of course, good luck to anybody out there who is trying to do dry January, or at least stick to any New Year's resolution at this point, because January 10th, I did go to the gym today and it was very, very empty. And I feel like that's kind of early in the month for that to happen, right?
Of course. No, thanks for having me.
Thank you.
All right.